Okay guys, so in this video we're just going to go through a quick observation of the knee when you get a knee patient in. So obviously we'll look at them from the front first. We'll be looking for, big one in knee would be swelling, so swelling of the joint. We'll be looking for redness, we'll be looking for any bruising around the joint itself. Looking at muscle bulk, so looking at muscle bulk through the quad. We're looking at hip height as well, so just generally at hip and weight bearing, so if the leaning on one side or weight bearing more on one side. With the feet, I would generally look for pronation, supination. Then if we get you to turn around for me. So then we'd be looking again for muscle bulk through the calves as well. You can look, it's quite nice to look at the feet and the Achilles, so looking at where the Achilles is. And then you can just do little tests where you actually come onto the talus and you actually pro and supinate the patient until they're in a neutral position, and then you get them to then relax, and you see how much deviation there is of the Achilles tendon, and obviously a big deviation would indicate that there's some natural pronation of that foot, so you can compare and contrast that on each side. Again, obviously you would be looking higher up into hamstring bulk, and you could look into just general glute bulk as well, one side versus the other, just to give you a general idea. Obviously you're going to do tests going forwards that are going to be more indicative of giving you suggestions of what might be going on, but those are the sorts of general things that I would look for in a knee pain patient. I don't know if about yourself, Glenn, or anything you'd add?
Yeah, one extra thing, if I turn you to the side, Green, is just looking at this knee position. Quite often you get people that lock out into extension, yes, particularly if they're quite flexible. You see it a lot with your dancers, gymnasts, that kind of thing. If they're locking out and just hanging on their knees, that can cause irritation of fat pad and stuff like that, and it can cause underactivity of the quads. So I would add that. Other than that, very similar. Yeah.
Perfect. So that's our knee observation or assessment.